Okay, I am here once again with Dr. Tomás Owens, who is one of the medical directors here at Epworth Villa. Dr. Owens, welcome. It's great to have you here today. Thank you so much for joining us.
Thank you very much for inviting me.
It's a pleasure, and we're here today to talk about really a couple of things. First of all, we'll start talking about COVID and Dr. Owens' experiences with that at Integris and within his practice. And then we'll move into some discussion about the vaccinations and the process and the progress that we have been making. And so before we do that, just for folks that may not have seen the last little webinar, if you will, that we did together, please give a quick introduction of yourself and your background.
Oh, well, thank you very much. I'm Tomás Owens. I'm a family physician with further training at the University of Oklahoma with further training in geriatric medicine. I finished a fellowship in geriatric medicine at the Mayo Clinic in Rochester, Minnesota, back in the day. And I've been in practice at Oklahoma City at both the University of Oklahoma and the Integris Health System for the last 30 years. I've been exclusively at Integris and here at Epworth since 1995. So it's been a long while. Of course, I started at Epworth a little later once I got more established. I see primarily people, well, about everywhere really. My job at Integris involves teaching resident physicians in family medicine, so we cover all the units of the hospital, including pediatrics and OB, and then I bring my resident physicians here to see patients and of the older age group at Epworth Villa.
Well, we are blessed to have you as a part of the Epworth community. Thank you so much for this long tenure now that you've had with us. And if we may, let's talk about your assessment of COVID at this point in time. I mean, there's a lot of media coverage, a lot of coverage saying, boy, the hospitals are getting overrun. There's potential for quality of care and even rationing of care. What are you seeing? Can you help to verify what folks may be hearing in the news?
Well, to tell you the truth, the majority of what you're hearing in the national media and the responsible sources is fairly accurate. The situation is quite dire, and I'll be honest with you, I did not expect it to be this serious. My thinking was, why would an epidemic in 2020 be just like an epidemic in 1918? I mean, 100 years have gone by. And unfortunately, the pattern is extraordinarily similar. We have the peak and then the lull and then the second wave, which was worse than the first. And we're right now nearing the peak of the second wave. So the numbers of patients are really extraordinary. To give you an idea, we had to open 2 new units at Integris Baptist Medical Center. And we're still having a long trail of many hours of people waiting in the emergency room to be admitted. We've reached now a point where more than 70% of the patients in the hospital have COVID. It's really serious, and the numbers keep going up, which every small surge that follows gatherings of people. So we had the surge to post-Thanksgiving, and now we're expecting and we're starting to see really the post-Christmas. So the numbers are pretty extraordinary. Now what we do have now, which we did not have in 1918, is the possibility of really decreasing this second wave and hopefully obliterating the third wave by virtue of having a vaccine.
So let's talk about the vaccine. What is it that you have seen thus far? I mean, how are you doing, first of all? Because I understand that you just had your second dose.
I surely did. I had my first dose December 16th, and I got my second dose today. No, I feel great, other than the arm being a little sore. I really haven't had any side effects. I'm very blessed. Having said that, I welcome some degree of side effect to assure me that the vaccine is working. And what you do see with those is sometimes a sensation of muscle aches or maybe kind of a brief shaking chill the day off or maybe the morning after you get the immunization. Other than that, other side effects are extraordinarily low. And if I may add to that, I think one way to look at it, a person from the National Institutes of Health in the area of infectious diseases was quoted as saying, you know, in this situation, this is like saying that they drop you off in the middle of a fast-running 8-lane interstate, and you worry about getting hit by a meteorite. Yes, you can get hit by a meteorite, no question about that, but you have a little bit worse problem at hand to negotiate those lanes. And right now, that's the way I see it with COVID like it is going. That is the serious problem. Some extraordinarily rare side effect from the vaccine may not be what I want to worry about. I just don't want to get this disease.
So you mentioned something about you really would like to have some side effects. Explain that a little bit more. Why is that, and how is that important to a person receiving the vaccination?
Well, when the vaccine gets into your body, it's supposed to put your immune system into work. It's supposed to make you produce antibodies against this virus that they're getting fragments of and exposure to. And many times that ability of the body to do that is associated with some sense of overdrive, that little maybe a little chill or a little even a light temperature or maybe muscle aches. And to me, being a doctor, of course, that reassures me that the shot is really working.
Okay, absolutely. Well, let's talk a little bit about the hesitancy that some people are still expressing about receiving the vaccination. You know, we still have a phasing that we are going through, and here at Epworth, this Thursday, as we are on a Monday recording this, so just a few days away, we'll have our first round of vaccinations in our health services. Walgreens will actually be coming in and providing vaccinations, a clinic for the residents in our health services area, as well as the staff that work in that area that decide to go forward with the vaccination. And then a week later, we will have the assisted living. And then we're working with the city-county health department to be able to have a clinic for our independent living residents and the remaining staff as well, and hopefully that as well here in the month of January. So we feel really good about the process, the progress that we have made. But we know that there are people that still have hesitation. In fact, I saw even the State Department of Health came out and said that, which I think is a good number, 65% of folks are planning and do intend to take the vaccination when they have the opportunity, and that's here in Oklahoma. But there's still 35% that are hesitating. Dr. Owens, what might you say to those folks? What are you hearing as some of the common reasons for that hesitancy, and how would you respond to that?
Well, I tell you, first of all, congratulations to you, to us, I guess, to all of us here at Epworth for getting this running so quickly. I mean, it's an incredible undertaking, which has not been seen since the times of polio, so this is extraordinary. I think it's really critical to first get an idea of the risk-benefit. I mean, think about that. Influenza kills about 0.01% of the people that get it. This disease kills 0.6% of the people that get it. That's 600 times higher chances of dying from this. It's still a small number, but you don't know which is your ticket. And if you happen to have that ticket, I don't know if I have it, which now we know is related to certain genes that some people have that make them more susceptible to the disease and to the complications. I certainly don't want to take that gamble. I'd rather go ahead and take an immunization and prevent it. Now, what items that are involved here are many, and some are difficult because some are political and people's most internal beliefs about the roles of government and so forth. But I'd rather dwell in the medical side of this. Yes, this vaccine was accomplished quite rapidly, but for most people, it's not really known that a lot of this research has been going on for a long time. I quoted last time as the mRNA vaccines were in the works about 10 years. Well, they actually been in the works for 30 years. They've been on a little faster speed the last 10 years. And with this crisis, what the government was able to do with Operation Warp Speed is simply put more funds into all these companies, private companies, not governmental companies, to develop and expedite the research, get more funds to get more people tested, get more funds to get more people in the trials. The second point is trials for vaccines involve thousands upon thousands of patients. You can do a trial for a cardiac medication, a heart medication, with a couple hundred people, but you really can't do a vaccine trial with less than 20,000 patients. Most of the time it's a much higher number than that, in order to see if it's really efficacious. So the amount of resources involved and the track record of the companies involved, and the fact that the FDA has scientists that reviewed the records, make me very, very confident to take it for myself. And again, I balance that. Yeah, there's a chance in many, many thousands that I would get some side effect, but there's a much higher chance that something goes wrong with me if I get COVID.
So I have heard some folks say that they will likely take the vaccination, but they just don't feel comfortable right now. They just feel like it's just too new. There's not enough experience with it yet. That normally, as you've kind of indicated, it takes years for a vaccination to be developed, and this one seems so quick. Is there anything else that you could say to someone who is still just not willing yet to accept that vaccination?
Well, first of all, they're exactly right in the concern this is new and is different. So I don't really underestimate the importance of that thought. But my reply to that, the reason I decided to go ahead and take it, is that yes, the research has been faster, has been more expedited than ever before, but the situation is a lot more extreme than ever before. So when I balance out, is there a chance something goes wrong with this? The technology has been around for a long time, really well studied, and just more rapidly developed recently, versus the chance of getting the disease. To me, it's a no-brainer. It's really simple. But I understand the concerns of people. I think sometimes you have to just take the step, have faith, and go for it. That's what I did for the second time today.
I've also heard another sort of concern that folks have is that, and you even mentioned the genetics of this from a susceptibility standpoint, but there is also a concern that somehow this vaccination is changing the DNA of the individual receiving it. Can you address that?
Oh gosh, yes. That's a common misunderstanding, and I'd rather not go into all the details of the cellular structure and so forth, but suffice it to say that this mRNA is an imitation of a product that our cells make. The product that we use as an intermediary to create the proteins which makes all that we are. Like our color of our eyes, our hands, everything is made out of protein, and likewise the antibodies. So what this vaccine does is, instead of exposing you to a protein to irritate your cells so your DNA would create mRNA and then create another protein, or get a fake virus, if you wish, to go into your cell and do the same thing, this one just cuts to the chase and gives you the mRNA already, the molecule that you naturally use to make antibodies. The mRNA works outside the nucleus of the cell, and there's no way for it to go back in. So there's no way that mRNA will turn into DNA or do anything to the DNA. They just happen to be related, but there's no way that it would change your genetic makeup. But of course, the internet takes all takers. So all sorts of people with different theories and different thoughts about life can put things in the internet. So that's where you see a lot of those opinions. But I have a zero concern that my DNA would be changed in any way, because it's not scientifically possible for an mRNA vaccine to do that.
Speaking of social media, a lot of these things get circulated on social media. One of them that I saw had to do with fertility, and that somehow this vaccination could be impacting fertility for women. Yeah. What can you tell me about that?
Yeah, once again, it's very legitimate for a young woman to be preoccupied about that, and I really encourage people to have second thoughts about doing anything in relation to pregnancy. Now, the beauty of this vaccine is that since it doesn't have the virus at all, it cannot make you sick. There's no way that even if it malfunctions, it will make you sick. So essentially, it's going to activate your immune system in the same way that it would if you're not pregnant. And since I just explained the mRNA doesn't change your DNA or even in any way relates to your DNA, there's not any scientific risk known about taking it either before you get pregnant or while you are pregnant. Right now, the CDC is recommending that if you are pregnant, you can choose to have it. I mean, they're not saying that you must have it, but you remember that pregnancy is a lower immune state. So it's wise to boost it up with an immunization. So if my wife was pregnant, she just told me, God forbid, she's 60 now, so she's probably not planning on that. But if she was, she would take it.
And not to get too personal, but have you had conversations with your own family, and are you recommending to them to take the vaccination?
Oh yes, but the conversation's in reverse. My family is trying to find any way possible they can cut to the line and get immunized. I told them that's not ethically acceptable. We need to have the higher risk people first. But yes, now my son, of course, got immunized today. He is a physician at the University of Oklahoma. But my daughter and my future son-in-law, if I can call him that, and my wife are desperate to get immunized as soon as possible, and it's still going to be a little while since they're lower risk. Having said that, this is a personal caveat of mine, but it's very true. In situations like this, sometimes it's better to immunize the low-risk people, because low-risk people, they may not get too sick, but they give it to a ton of other people. They're more active, they're out there in the community, and they many times have 2-3 days even that they're very contagious before they even have symptoms. Then the first day they may not know they have COVID yet. So for that reason, it would be prudent if it was possible. We had the wherewithal and the logistics to do it, to immunize everyone, low risk, high risk, everybody at the same time.
We have heard some things about the logistics of getting the vaccination into the arms of the American people, and whether it be the healthcare workers or now, very soon, older adults. Are you seeing anything or hearing anything that is indicating that we should be worried about the process of getting the vaccines out, and any updates that you can provide on that regard?
As far as I understand it, the commander from the United States military that is involved with the Operation Warp Speed has assured us that the chain will be perfectly followed on how to distribute the vaccine safely and not lose the correct temperatures and everything else that have to be attained. It's going to be, of course, more challenging to the one that I got, the Pfizer, because it has to be very, very cold. Minus 70 Celsius for a time, and only a few hours below that temperature, about 5 to 6 hours. The other vaccines can be in regular refrigeration. And so far, all the ones that are candidates to be approved are 2 shots, one separated by 3 or 4 weeks for the next one. And the other issue is that there's one vaccine that's probably going to be a single shot, but that one is a little bit lower in the level of research, so it's not going to be approved just yet. That's the Johnson & Johnson. But no, I feel fairly confident they're doing the right thing about preserving, because they've been doing this forever with other vaccines like varicella or the shingles. It's just like the massiveness of the numbers of people that are going to need this vaccination is just so overwhelming.
Well, one last question. If someone has had COVID, how long should they wait until they are vaccinated?
That's an excellent question. I think I alluded to this the last time we spoke, is this epidemic, we've been learning as we go. And so many things have changed, and I'm going to digress a second, but remember in the beginning we said we had to disinfect our groceries with Clorox when we took them home, only to realize that's silly, really doesn't transmit like that. But likewise here, at first we figured, well, if you had COVID, you probably should wait 90 days to get the immunization. Then we said maybe a month is fine. Now we're talking, if you had COVID 2 weeks ago, you might as well get the immunization. Having said that, a number of people that got COVID will be protected from the disease just by having had COVID, but we can't tell which ones are those. So we're still recommending people at high risk to get immunized even though they already had COVID. And if it's been 10 days, 2 weeks is perfectly fine to do it. You're going to be more guaranteed that your immunity will be better than the one you obtain naturally. And interestingly, that's sort of opposite of what we learned, right? With measles, those of you that are old enough to, having had friends that have measles, we knew that if you had the real thing and you didn't die, you were really well protected, and not as well with the shot, if you wish. In this case, it appears to be the reverse. The shot is a lot better protecting you than having had the disease.
Well, something that I've noticed as I've watched some of the statistics come through, first of all, I look at the excess deaths number, because that, even if there is some controversy about what the cause of death was, whether it was COVID or non-COVID, that excess death, the overall death, gives you a sense of the impact of COVID. And it certainly has been higher for a longer period of time during this 2020 pandemic than any other season. Maybe like the 2018 flu season might have been a high excess death, but it didn't last for as long as this has lasted. And I've noticed in Oklahoma that our death numbers for COVID have actually been lower than other states. I think we're maybe 41 out of 50. However, on the case rate, we've been climbing. Our cases have been going up relative to other states. I don't know what to make of that, and I just thought I'd pose that to you. Do you have any sense as to why our cases would be going up, but relative to other states, our deaths would actually be going relatively down?
It's hard to explain at this moment because a lot of this analysis have to be done a little later. Death lags about 2 to 4 weeks after the spike of cases. Most people that get this disease don't die that quickly. So we need to see what the pattern of deaths is, say 4 weeks from now, compared to the spike in cases right now, to see where we stand. But I think we do have a lot of advantages here. One is a widespread state, so a lot of people have more opportunity to be out there without being really close to other people. And consequently, even though our spikes are dramatic, they're nothing like they were in big conglomerated cities like, say, New York City or New Jersey early in the epidemic. So when you had rushes like they had, and you just simply don't have the beds to accommodate people, mortality is going to increase. We haven't been to the point yet, but we have actually literally no beds to put you in a hospital right now. And hopefully we'll get to that. I think if we do get to that, it's going to be in the middle of this month of January, which everybody's forecasting as probably the highest that it will be in the whole epidemic, is between, let's say, the 12th and the 21st of January, just based on the different calculations. And at that point, we may get to closer to that point. But we've kept up, actually, with the demand by increasing the accessibility of ICU beds and decreasing the use of the other beds in the hospitals. Like I said earlier, we're occupying a lot of our beds with COVID patients that could have been there for, I don't know, a hip replacement or something else. So with that, I think that may account for some of the ability. Also, that we got into this process a little after the other states did. So we learned a lot about the few things that do help you survive, and the changes in the management that give you a better shot at surviving this problem. Is it also some genetic variant? I don't know. It's really hard to tell until I get the data evaluated backwards.
Well, Dr. Owens, thank you for these very informative and helpful answers to these questions. Is there anything else that comes to mind, if you just want to say one last thing to someone who might be watching to encourage them?
I think there's light at the end of the tunnel. I think the ingenuity, imagination, and strength of the United States of America is shining through to this. We're going to win this battle, and I think there's going to be, of course, for many, very, very sad aftermath of losing a loved one, but for the rest of us, a big silver lining in the end, with faster development of vaccine for other problems, better understanding of epidemics, and hopefully better health for all of us.
Well, thank you very much. This has been a pleasure And thank you so much for all that you're doing to help the patients here in the Oklahoma City area, and especially those here at Epworth.
God bless.